So, what is the success rate of infertility treatment and how expensive is this treatment?
See, the success rate globally is only 40%, right? Even if you see an ad of a infertility center saying 100% results or 90%, it's all lie. It's not possible. It can range somewhere from 1.5 lakhs to 2.5 lakhs. Then with multiple cycles, of course, the rate increases. We at Life, which is part of Mind and Mom, we work constantly on how can we bring this for 99,000 rupees so every woman can afford it.
What is the process of treating infertility for men? 1, 2, 3, 4. So you must be having women with PCOS and PCOD coming to you.
Right.
What are the chances of such women getting pregnant?
See, I think it's a myth that people think with PCOD and PCOS you cannot get pregnant.
So, what is the success rate of infertility treatment? You have so many clinics now cropping up everywhere, all over the city. You find so many clinics. But what is the success rate and how expensive is this treatment?
See, the success rate globally is only 40%. Right? Even if you see an ad of a infertility center saying 100% results or 90%, it's all lie. It's not possible. Right? Globally, it's 40%, but there are doctors who have done it till 80%, till 85%. But on an overall, it's not that great. But with every fertility center mushrooming in every street and the cost being very high, quite honestly, a straightforward case can range somewhere from 1.5 lakhs to 2.5 lakhs. Then with multiple cycles, of course, the rate increases. We at Life, which is part of Mind and Mom, we work constantly on how can we bring this for 99,000 rupees so every woman can afford it, be it egg freezing or be it fertility treatment. We want to bring in that whole cost of affordable fertility treatments. We are able to achieve that because we are an asset-light model and we work around a lot, bring in a lot of technology to make the success rate is more, at the same time costing is low, bring in doctors who's not too focused on high profit. So we're working out a model that's where basically like any other entrepreneur, I want to disrupt the market, but it's going well. It's quite honestly going well as a path.
So how are doctors taking you, accepting you in the community?
My co-founder is a doctor and I have a lot
He joined much later, right?
He joined much later,
right.
Correct. That is true. Initially, of course, it was very difficult. When I first went and, met doctors, like the first doctor I met was Dr. Priya Selvaraj from GG, who had been like the OGs of, infertility and fertility treatment. She and her mom, she was very encouraging, but I spoke to Dr. Priya Selvaraj. But over time, when I met a lot of doctors at that point, everybody was like, it's all going fine. Doctors are there. What are you going to do with the app? And do you think there are quite a lot of apps which is tracking the periods and all that? What are you going to do differently? People were very reluctant. People thought it will not work. Maybe, what I've realized about doctors is that they're also little wary about introducing something to the patients, because it involves a lot of responsibility from the doctor's end as well. So people were reluctant, but then I was very consistent. I will never take no for an answer. I would go meet the doctor again and again and again. And at one point in time, she has to say yes or he has to say yes. Then we've got now a lot of our investors are doctors, are medical professionals. So over time it worked. Of course, initially it was difficult.
Do you look at yourself as an aggregator of infertility clinics in some way, Uber or of infertility?
Oh yeah. I think one of the investors also asked me if you are an OYO for a fertility center. Okay. That was an interesting thing. But quite honestly, we don't do aggregation. What we bring in is asset-light model, where it is our clinics where people come, which is completely owned by us. But then only for the procedure, we rent an operation theatre, because 70% of the hospital assets are underutilized. Why go create another operation theatre, another thing for 4 crores? So I have to end up charging a lot to the patient.
It's kind of fine tuning or improvising on outsourcing, something like
Correct.
outsourcing?
So my doctor goes to the hospital and does the treatment by which I'm able to reduce 50 to 70% of the cost from 2.5 lakhs to 3 lakhs to much lower cost. So this way you get the solution, you get it in a nice place, premium place. You're not going to a hospital which is not very clean and smell phenol. No, it's not the same. You still get the kind of experience for a much cheaper price, because IVF is not under insurance. It is not under any other model. So for me, out of pocket, and then it works perfectly well. And this is what I will choose any day. And it is a proven model with Pristine Care and so many other players in India. For a country like India, it is a very proven model, and that's what we are trying to bring for women health.
Great. So can you explain step by step what is the process of treating infertility for men? 1, 2, 3, 4.
So the step number 1, like I told you, is understanding their lifestyle, and then asking them to lose weights and go to the gym, or whatever works for them, put them in a healthy diet. This is the usual natural way. 3 months of tablets, 3 months of folic, and then the general thing. Then the step number 2 is IUI, where naturally the doctor tries to get you pregnant just with the IUI process. It's a much easier process than IVF. It's again a daycare procedure. They get it done in a day, and a lot of people get pregnant with IUI also. Then let's say there is a failure with IUI also, then people go to IVF, which is a little elaborated, which requires a lot of injection for the women as well, hormonal injection.
So at this stage, when IUI fails, this is where you find out the treatment is to be with the men or women. This is the stage where you find.
Exactly.
Okay.
So doctor might also find it even before that, because let's say there is something called AMH, which is understanding the blood quality, egg quality through the blood test. So by then itself you will know if your egg quality is better, and then you look fit and all that, then you know automatically whose problem is that. Then you check the men. So the doctor will easily find who might have the problem, and then they go to IUI, figuring out, okay, maybe let's just fix the egg problem or the sperm problem. Then they move to the IUI. Then over time you will realize where things needs to be fixed, and then they move to IVF. IVF is a very elaborated procedure. A lot of simulation happens for the women to improve her egg quality. A lot of injections are given like continuously for 15 days and so on. It also depends for people to people. So again, there is I'm sure you would have heard of test tube babies. It technically happens in the test tube, right? You take the egg and then you take the sperm, you just make that as an embryo, and then you freeze the embryo and then wait for the right time and put that inside the uterus. I'm just giving it in a very natural term, like a layman term. Of course, it all has a very scientific way of calling things, but I'm talking like a patient to patient. So then the pregnancy is positive. If the pregnancy is positive, then there is a flow of pregnancy, a little careful pregnancy. And if it's a failure, again, and another egg is sort of simulated. So many things depends on a lot of if conditions, it goes on.
So you must be having women with PCOS and PCOD coming to you.
Right.
What are the chances of such women getting pregnant?
See, I think it's a myth that people think with PCOD and PCOS you cannot get pregnant. I think a lot of women these days has PCOD, and out of 10, at least 6 or 7 are affected in different levels. It's not like everything is severe. Like I was telling you, I am having PCOD, and a lot of women, you will not even think they have PCOD, but they will.
So what are the symptoms of
having a PCOD,
so that people can understand?
I think PCOD has a lot of stages. The initial ones are like totally solvable, or you can manage it with the lifestyle changes. Then over time, obesity, irregular periods are the main things like how you can find somebody has PCOD. Then infertility can also happen because of PCOD. But can women get pregnant with PCOD? Yes, possible. Maybe with a little bit of treatment and medication. Yes, it is possible. But PCOD is definitely a problem. If you ask me if this is a problem, yes, it is a problem.
And such women can get pregnant.
Get pregnant also, yes.